My name is Olivia Hoblet. I am with the Trinity Love Hoblet Foundation. I have here with me is Dr. Ajay Wakhloo, who is one of the board of directors for the Trinity Love Hoblet Foundation. Dr. Wakhloo, thank you so much for joining us. Tell us a little bit about yourself and how long you've been in the medical field.
Yeah, Olivia, first of all, good afternoon. And I want to thank you very much for all the wonderful work you have been doing in Florida for patients and survivors of brain aneurysms, and also for the foundation, what you have done over the past years. And I have been following you. It's quite impressive work, especially the education you are providing to our community in Florida. So I have been in this field for over 30 years. I graduated from Germany. I'm originally from Germany. And at that time, the attention on aneurysms was only focused around patients that presented a rupture of the brain aneurysm. As you know, 40% of the patients who have a ruptured brain aneurysm don't survive it. And only later it was obvious that it is important in our field to screen these patients and look for aneurysms that have not ruptured and study certain features of those aneurysms that have a higher propensity to rupture. So in our field, over the last 30 years, studying brain aneurysms, the diagnostic as well as the therapeutic aspect has dramatically changed. What is missing still in certain communities is a widespread education of the family members that have maybe one or two family members that have aneurysm, and we can talk about that. The need for a screening, really a thorough screening program of these patients.
I agree, Dr. Wakhloo. We're listening from some of the survivors here as well in Florida, and they're finding it with the family history, with the mother and the son and the daughter, and the doctor is recommending the same thing as the screening is very important because, when you catch it on time, you have more chance of survival. And that's why I would like to bring up next is Carrie Casey. She was a former nurse at the Leahy Medical Hospital. And that was such an inspiring story. And we'd love for you to share Casey's story a little bit with us and about her brain aneurysm.
Yes, so Miss Casey was very special because she was one of our former nurses in the hospital. And she had a history of headaches, but one day she experienced headaches that were different. And you will hear that from many patients that they have a history of headaches, sometimes even migraine kind of an headaches, and something changes over time. And that is a time where a screening needs to be done, MRA or CT angiography, that infrequently show an aneurysm formation. And patients or subjects are very sensitive to that experience, that something shifts. And we are only now trying to understand, why do people have this shift in the headaches? And Miss Casey presented with that. She noticed that there was a difference, and I see that in many patients. And we think it has to do with inflammation within the arterial wall, and that patients sense that very well. So then Miss Casey came to us, and we did a CT angiography and found this aneurysm that needed a treatment based on its size and location and certain other features. And we did then an angiography, a diagnostic angiography, which is similar to the heart, where we thread in either through the wrist or in the femoral artery in the groin area, a small tube called a catheter. And then we inject dye in various arteries of the brain, and then we image it. And once we find an aneurysm, then we sit with the patients and discuss further treatment options.
Wow. You have this new technology that you actually designed and was just recently approved by the FDA. And this is the first time this device was ever used in the United States, correct?
Correct. It was, Olivia, it was the first time that the next generation of the flow diverter that recently in August got the FDA clearance.
Wow.
We were the first site where we introduced that, and Miss Casey was the first patient who agreed as to having done it.
Congratulations, doctor, because this kind of invention is really what we need to make sure that everyone is educated, because you have the proper instrument and to be able to treat it. And that's why you said awareness is so important. Just to remind everyone, what symptoms do they need to look out for when it comes to brain aneurysm?
So generally, the classical symptoms of a ruptured brain aneurysm. So once this bubble within the artery breaks apart, blood gushes into the brain, and that is experienced by the patient at a thunderclap like a headache. They say it's like a lightning. Some of the patients even lose the consciousness and fall to the floor and hurt themselves. And the headaches can be excruciating. And many people have seen is they try to take Tylenol or aspirin, other things. Please, when you experience a thunderclap like a headache that you have not experienced before, please call 911 or go to the nearby hospital for further workup. Other symptoms for headache can be what we call cranial nerve deficit. So some aneurysms are so big and that they secondary, when they rupture within the wall, they grow and they can compress on nervous system, creating double vision. That's another symptoms, or even gait disturbance or weakness of one or the other side of the body. So when you experience these kind of symptoms, please make sure that you go to the next emergency room.
Thank you so much for that information. It is so important. And I'd like for you to also share with our viewers the importance of the family history. Now, this is the good time to really know your family history, right?
Yes, Olivia. You're bringing another very important aspect. When I was back practicing at the Jackson Memorial Hospital in Miami, we oversaw in those 7 years about 700 to 800 brain aneurysms.
Wow.
And then I moved to Massachusetts, worked at University of Massachusetts, and we started looking into the incidence of aneurysms in the families. And at Leahy, I'm doing the same thing. And it's about 10 to 15% of the families harbor aneurysms. So when you have at least 2 members in the family that have aneurysms, then you definitely should screen other family members, siblings, or your own kids when they're older than 20 for aneurysms. And generally MRA, magnetic resonance angiography, suffices as a screening method. It's a non-invasive method for your family members to detect whether they suffer from a brain aneurysm. So once again, 10 to 15% of the families harbor aneurysms when you have at least 2 family members that have aneurysms. Now, infrequently, I suggest to patients who are young and have multiple aneurysms to get a screening of the family members. And the reason being is that just the propensity of what we call it collagen disease or weakness of the artery that can lead to multiple aneurysms, we are then more eager basically to advise the family members to get screening of their siblings or their offsprings.
I'm hearing that more and more from the other doctors as well. A young gal that I interviewed, she's from California and her father died from the brain aneurysm, and she finally decided to get checked, and as it turned out, she did have a brain aneurysm, but she was very fortunate because they were able to treat it right then. And so she was very thankful for that, because she also heard from other people that you should really get checked out because this could be hereditary. One of the questions that was asked, do the children get brain aneurysm at an early age?
Yes, children can get aneurysms, especially certain forms of autosomal dominant kidney polycystic kidney disease. They have a higher propensity to develop aneurysms, but there are other syndrome complex where patients have at very early stage aneurysms. That's very unfortunate. It's very rare, but those aneurysms can grow very fast and are very difficult to treat. Sometimes aneurysms, like dissecting aneurysms in kids, in younger population heal, have a higher tendency to heal. So we have to balance very carefully when to intervene and when to let the child heal on their own.
Dr. Wakhloo, I can't thank you enough for your time today, just with great information. And we really want to get to our viewers out there the importance of brain aneurysm, why you have to know about it, why not to ignore the symptoms. It's really important. And your expertise is so valuable to us. And of course, we are so thankful for all your hard work and leadership to the Trinity Love Hoblet Foundation. We are so blessed to have you on our team. Do you have any last advice to our viewers before we go?
If you experience any symptoms such as severe headaches, headaches that are unusual for you, if you suffer from migraines or other kind of headaches, if the pattern of your headache or intensity changes, if you have speech problems, weakness, double vision, balance problem, please consult your physician or go to the next emergency room. That's very critical. That would be my advice.
Dr. Wakhloo, it's a very important advice. And again, thank you so much for joining us and for all you do for the Trinity Love Hoblet Foundation. And we look forward to continuously working with you. And we hope that you have a great day. And I know that you're always busy out there saving lives. So we thank you so much for your very valuable time.
Thank you, Olivia, and thank you for your leadership and the foundation for all the wonderful work you are doing.
Thank you.
Thank you very much.